We now have a question from Vera Okiongo, from, my apologies, Vera, if I've got your name wrong, from Nation Media Africa. Vera, are you on the line?
Yes, I'm on the line. Can you hear me?
Yes, very well. Please go ahead.
All right, so I'm just going to rush through it. I would like to know, in the modeling that you guys have done and I've talked about, I'm not very good in statistics. Is there any indication of how this thing may affect African countries? And just quickly on top of that, we have the Africa CDC, and I would like a comment from the Director General how they plan to support it. It was being funded by the AU, but the last time I talked to the Deputy Director, money seems to be drying out there, and the work that they're doing now is very critical given the health systems that we have in Africa are very fragile. Thank you.
So I could start, and Mike will supplement. So I can start on the first part of that with the questions about the use of mathematical models to look at what may happen. So we are working with a number of groups that are looking at these types of scenarios in terms of using available epidemiologic information about how this virus is transmitted, the rate in which it has moved through populations in China and Italy and in other locations, to use those parameters, as we call them, to estimate what may happen in a new population in Africa, for example. And in using that information, you can estimate what case numbers and deaths may look like if we don't do anything, if we don't have any interventions. And some of those numbers are very high. Some of those numbers are quite scary. But what those models can also do is they can also look at what may happen as you implement certain interventions. And these are the interventions that we have outlined, which are public health measures, which are physical distancing measures, which are making sure that you have testing capacity improved and finding all of your cases. And when you look at those scenarios, those case numbers reduce. So that's what is important in those models. They also help us plan. They also help us estimate case numbers based on what level of severity they may have. If they may have mild infection, moderate infection, may be severe and require oxygen, may need ventilatory support, respiratory support. Those models help us estimate what kind of supplies we need. And we're using those right now to estimate what we would need to supply for countries. And so they've been very helpful. We can look at the country level, we can look at regional levels, and we're working with modeling partners to create tools that countries can use to help prepare.
And just on Africa CDC, actually, the Director General and I spoke with John and Kengasan. John is the Director of Africa CDC, and in fact has taken on a role as a special envoy of the Director General and for COVID-19. Africa CDC is a very important institution in Africa. WHO supported its creation. Director General was one of its founding members before he took his role as Director General, and Dr. Chidi Moeti, our Director for the Regional Office for Africa, and John work very closely together to ensure that member states and countries in Africa get the best possible public health and health advice, inputs and support from both our organisations. We've worked together with the Africa CDC on training lab technicians in COVID-19 diagnosis from all over Africa. We've worked together on the distribution of laboratory tests, and we're currently working together with colleagues in China on the procurement and distribution of PPE across Africa. So I would characterise very strong operational, growing technical and operational relationship with our colleagues in the Africa CDC. And obviously, in future, WHO in itself is not a funding organisation. We will always be advocating for the funding and support to strong African institutions that provide support all across the continent. And I'm sure through this response, one of the benefits, if there is anything to be seen in benefit at the moment, is we need to build stronger public health systems at subnational, at national and at global level. If any lesson is to be learned from the current pandemic, is that we need stronger public health systems, and we will work very hard with our Regional Office for Africa, with John at Africa CDC, under the leadership of the Director General, to deliver stronger public health and health systems on the African continent in the coming years.